Hello, my name's Paula. I'm here tonight to talk to you about the finances for the Trust in 2019-20. I'm the Finance Director, so it's my responsibility to look after the money and make sure I can explain it sensibly to you guys now. It's been a challenging year, and for those of you that were here last year, you will recall me saying probably something similar. And we have, unfortunately, had another overspend this year due to pressures, but I will take you through in more detail over the following slides. Some of you will be aware of how the finances are done in the NHS, and we are asked to focus on something called a control total, which is set for us at national level. Unfortunately, we weren't able to achieve this, which we were hoping would be break-even, but we actually had an overall loss of 3.4 million at the end of the year. When you look at the accounts in a true accounting way, which includes all sorts of technical adjustments, the deficit increases to 5.7 million. Although this was an adverse position, and we are naturally disappointed with that because of the impact on our cash balances, it was a better position than we thought it would be at month 9. We were really concerned it was going to be probably £3 million more loss than that. So we did have a really good recovery in quarter 4. I'd like to thank all the staff who contributed towards that improvement with their own efforts. Every year it's challenging on the money, and people work really hard to do the best they can with it for our patients. The slides will show the sort of total income values, most of which, as you would expect, is from our local commissioners in CCGs and NHS England, and importantly, the local authority in Public Health England. Our spend was higher this year. We had continued use of out-of-area beds for mental health patients, and it was really important that those beds were found for our patients and that they had the care they needed. But it comes at quite a considerable cost, which we're not funded for, and that fully explains why we were overspent. We also incurred agency costs, and again, from a continuity of care perspective, we'd rather be able to reduce those and increase our permanent staff, and it all has a financial implication. The reason the deficit's important is because it affects our cash, and cash is the thing that allows us to spend money on capital. And that's a really important part of what we do and how we improve our services. I'll come on to more of that in a moment. I mentioned earlier that we every year have to make savings, and I think teams did incredibly well this year to deliver £13.2 million of savings. Some of it was only achieved as a one-off, which means that the requirement still exists in the new year to keep on making savings. That makes it quite difficult. We were really lucky in achieving £4 million of provider sustainability funding, which is the national incentive for hitting your control total, which we did in 3 out of the 4 quarters. Which is really good news. If we could have achieved it in quarter 4, it would have been an extra £2 million, but we were not able to. As I mentioned earlier, agency and out-of-area beds, the figures are on the slides, were 2 of the pressures that we received. On areas of improvement, though, we try and make sure that we don't spend money unnecessarily. So things like compensation payments for loss of office or payments to directors that are not on the payroll or external consultants, that spend was really low last year. And we did really well on paying people on time, which as we move into the new year, and I'll do a little bit on this later, paying people quickly, our suppliers, is really important to their cash flow. Our sustainability risk rating with NHSI was a 3, which is not ideal, 3 out of 4, 1 is best. And our overspends on agency and deficit are effectively the reasons why we weren't able to achieve that the way that we'd have liked to. Just to quickly focus on capital spend, as I've already mentioned, a really good year on capital, as in the programme was quite high because of 2 substantial schemes on site at Tatchbury Mount, which are supporting our low secure CAMS patients and our learning disabilities low secure patients. We also managed to do environmental upgrades for fire safety and improvements to reduce fixed ligature points across the trust. We had other property improvements, things like substantial maintenance schemes, and did some transformation and redesign. Technology is always a big investment every year to ensure that our staff have got the information technology systems that they need and the kit that they need, and that was 2.1 million last year. We also, with support from the League of Friends at Lymington Hospital, we were able to purchase a new CT scanner to replace our existing one, which was 10 years old. And that was really exciting, and Lymington Hospital's now got a really top-notch CT scanner, which is fantastic for our patients of the Forest, but also for our staff and our way that we're able to use that machine. There are other smaller pieces of equipment purchased, but that is the bulk of our capital spend. So quite a big capital investment last year, 18.8 million. It was factored into the plan at the beginning of the year. But clearly, cash balances, if you look at a year where there is a deficit and high capital spend, you start to worry about the impact on cash. And we were worried. So at the end of month 9, we went to the department to seek a loan of £5 million to make sure that we were able to support the rest of the year the way that we wanted to. Interestingly, because of a change in the financial regime, that loan has just been converted into effectively an item on our balance sheet now, which means we don't have to repay it, and that's really good news. And that meant that actually at the end of the year, we closed our cash balance at 13.3 million, which, as you can imagine, is higher than we expected because of our financial improvement in Q4 and the loan coming in. But actually, in terms of reduction from the start of the year, it was 7.1 million. 13.3 million as a closing, though, was still 16 days of operating cash, so that was a healthy balance and meant that we've been able to consider a normal capital programme for the year based on the money that we start the year with. The final thing to talk about in quite detail is our charity, Brightaway. As I mentioned earlier, we've had a significant donation from the League of Friends for the CT scanner, which was just under £600,000. We've also had other donations from League of Friends around the various locations that they are. We've also been able to fundraise, including marathon runs and tea parties and a Christmas fair. And obviously, really importantly, we've been able to spend money on the things that are important to our staff and our patients. We're trying really hard at the moment to develop our charity. Clearly, the response for COVID and the national response to that, as well as local response from our communities, has been considerable. So we know that there's a big opportunity during this year to ensure that we raise really significant funds for the charity and are able to spend those funds on things that are important to both staff and patients. So just to do a quick summary to close on the financial outlook for 2020-21, obviously a really interesting year because understanding the impact that COVID was likely to have was something we became aware of in February, and nationally we started to work towards how we were to respond to the pandemic. From a financial perspective, what that meant was that all of the time we were spending trying to negotiate contracts with commissioners and working out what our plan for the year was, all of that was paused and is still paused because it was really important that as much of our resource as possible spent their time supporting our staff on patient care. So the financial arrangements completely changed, and we've been in a position all year where nationally they've wanted all provider organisations to break even, and that position has been in place from months 1 to 6, so that's where we've been. We've had all COVID expenditure covered by the centre, and that was important because people didn't want people worrying about the money as a reason not to do something, so they tried to remove as many barriers as possible. That's helped our finance team remove any barriers for our staff as well around financial affordability. It's been important to keep financial control in place, and we've absolutely done that. We're now considering how this works for the rest of the year. Clearly, as a trust, we have an underlying deficit position, and this is an amazing opportunity to try and eliminate that this year before we get back into the sort of normal swing of things next year. So our teams right now are focusing on how we eliminate underlying deficit. Important part of that has been the work that all of our local teams have been doing on reducing the use of mental health placements out of area, and they've made incredible progress on that to the benefit of our patients, which also has benefited the money. We're working with system partners to work out what the response now looks like for the pandemic. So for now until, well, at least next spring, we're obviously considering the impact of winter and the impact of COVID. And what are the services that we need to do that, and what's the financial implications and funding requirements for that. So that's the work in progress at the moment. Clearly, reducing vacancies continues to be important, and that will have a massive benefit on our staffing. So normally in this slot, I'm talking about what we're doing to try and, solve the SIP and all sorts of things like that, and how the new year's going. In a way, it's going better than it normally does, but it's because the financial regime has changed, and what we're trying really hard not to do is take our eye off the underlying position to make sure we start next year in a much stronger position. I know it would be incredibly helpful for our teams if they could be really clear on how much on their affordability and how many staff they have that's funded by our commissioners to run our services, working really hard internally and externally to do that.